Totally implantable vascular access devices, often called chemotherapy ports, are placed on a daily basis in South Africa for cancer patients expected to undergo repeated and/or long-term chemotherapy treatment. Ports are small, coin-sized devices connected to long catheters of 1 to 3 millimeters diameter that run inside the deep blood vessels to the heart. The placement of the tip of the catheter just above the heart is very important for avoiding blockage or blood clots. These ports are completely buried under the skin and can stay in place for many years. When a cancer patient needs treatment, a small needle is inserted through the skin into the port chamber. For the patient receiving chemotherapy multiple times a week or month, this is far better than having an IV placed at every visit. Not only can a numbing ointment make the needle prick completely pain-free, the port is easily identifiable so that only one attempt is needed for the nurse to get access to it. Chemotherapy often damages veins, making IV access more difficult with time. Ports save the veins and prevent the trauma that comes with repeated IV attempts on fragile blood vessels. Other vascular access options, such as midline catheters, Hickman lines, and traditional central venous catheters, are unsightly, inconvenient for patients, and have a much higher risk of causing infection or blood clots. By contrast, ports allow for a normal lifestyle without affecting showering, sports, or clothing choices. Ports have been around for a long time in the chemotherapy space. Now, however, the Vascular Access Multidisciplinary Practice, in partnership with Larke Medical, are proud to present the introduction of an even better member of the family, the PICC port. Traditional ports are placed prominently on the chest wall and are invariably performed in theatre under general anesthesia. The PICC port, however, is placed under local anesthesia in a consulting room and is hidden in the inner arm where it is entirely invisible and results in a significantly smaller scar. The PICC port has gained significant popularity in Europe, and a large Italian study on 4,480 patients showed an 86% patient satisfaction rate and a very low relative complication rate compared to traditional ports. Now, Larke Medical is one of the first clinician practices in South Africa to be actively promoting the technique. Using state-of-the-art technology allows our clinicians to not only identify the vein required, but also to track the tip of the catheter to within 1 centimeter of the desired location. This means significantly lower overall costs, reduced risk from anesthesia, greater convenience, we come to you, and an overall smoother, easier experience. Ask your oncologist. A PICC port could well make your journey a great deal easier.